I'm Liana Lowenstein, child and family therapist from Toronto, Canada, and I'm very pleased to welcome Brian Bethel to my YouTube channel. Brian is a child therapist from Ohio who works predominantly with traumatized children, and Brian is going to demonstrate a technique for use with traumatized children. So welcome, Brian.
Thank you. Certainly a pleasure. The technique that I have is a technique that I developed called What's Popping. It's a technique that offers both some psychoeducation strategies, but also opportunities for children to identify adaptive and helping coping mechanisms. Basically, in terms of supplies, I picked up just a small popcorn box at a discount store, but you can also use this with like brown paper lunch bags or anything that might resemble a container of popcorn.
Okay.
And I always start with asking a child if they've ever seen popcorn in a popcorn popper, and that popcorn bounces around. Sometimes that represents or could be a metaphor for what it is like following a traumatic event. Things pop into their head unexpectedly. So for the psychoeducation strategy, I would create a pre-made box of popcorn, and taking little slips, squares of white paper. All I've done is cut white paper into squares and have provided common reactions following trauma, and then write those on the slips of paper, fold them up or wad them up kind of like a paper wad, and put them in the popcorn container.
So they look like popcorn.
So they look like popcorn, absolutely. So then when children come in, it's a great way to kind of normalize their experience. I also have small slips of paper that, as we walk through this technique, they can add to the box of popcorn. But for the child, what I would say is, I work with lots of children where they have experienced whatever their trauma might be, sexual abuse, witnessing domestic violence, and many children provide information about common reactions. So I would then ask a child to choose a piece of popcorn from the popcorn box, and they can choose a piece of popcorn, and then as they unfold the popcorn, they get to read whatever that piece of popcorn represents.
Okay, and this one says bad dreams.
So if you were my client, I would then ask, so have you ever experienced bad dreams following your abuse?
Yes.
Okay. Well, that's certainly something that we can work on. And as the child goes through each individual piece of popcorn, we can normalize their experience. Also, again, offering them the opportunity, if there's something that is not contained in the popcorn, they can create their own. For some children, I'll send a small bag home and they can create kind of their bag of popcorn throughout the week of things that kind of pop up. So that's the psychoeducation piece. The second piece of this is really the development of healthy or adaptive coping. And that involves talking to children about these are things that pop up. So there you have nightmares. What would be something that we could think of to help you with nightmares that you've experienced? Do you have any ideas?
I don't know.
Okay. Sometimes when I've worked with other children, the use of a nightlight or putting worry rocks beside their beds, those are strategies that help them. So we would then take a yellow slip of paper, and just like popcorn, if you think of eating popcorn, what makes popcorn better?
Butter.
Butter. So the yellow slips of paper, we would write on the piece of paper, sleeping with a nightlight or worry rocks. And then we can take the white slip of paper, put it on top of the yellow, and the same manner of folding and wadding it up, and then it can go back in the popcorn, to which the yellow pieces or the buttered popcorn offer children strategies and techniques for dealing with whatever pops up.
And making it better.
And making it better.
I love it.
Thank you.
It's a great technique. I love both the psychoeducational piece as well as the the strategy of helping kids come up with healthy coping in such an innovative way that kids will obviously, respond to and just love the metaphor of it. So thank you, Brian.
Thank you.
Love it.
Thank you.
I guess one other question is, how are there some additional process questions that you might ask as you're doing this with a client? Anything else that you might sort of integrate into the activity in terms of processing it that you would recommend?
Sure. I've adapted this in a variety of ways, and of course, depending upon the child's developmental level, where they are in the therapeutic process. I had one child that really grasped a hold of the whole popcorn metaphor, and I was able to kind of take that into really the sensory aspects of trauma. So when we think about popcorn, popcorn has a distinct smell. Can you recall distinct smells associated with the trauma that you experienced? And this child was a survivor of sexual trauma. Their perpetrator was always intoxicated. So the smell or the odor of alcohol was a specific trigger. So I've used that in that format. We also talk about sometimes the random popping in terms of triggers, and it's a great way to, again, provide psychoeducation just about aspects of trauma related to the unexpected, the triggering, the reminders that occur associated with their traumatic experience.
That's a great, wonderful addition to making this already wonderful creative intervention even more creative. So thank you, Brian.
Thank you.
I love it, and I know that people watching this video will really find this to be a very valuable technique. Thank you so much.
Thank you so much.